So, the numbers have spiked in Stanislaus County, as you know, and a lot of these cases, two-thirds of them are Latino cases. Why do you think that is?
Well, there's different factors that are playing into this. One of them is the labor factor. The other one is the finance factor. And the third one is a cultural factor. So the labor factor is that a lot of the essential workers have been Latinos, and there has not, I'm talking about manufacturing, agriculture, cleaning, construction. And some of these jobs, they require you to, that you can't do these from home. So in some cases, there is not necessarily access to be able to be 6 feet apart from each other and be able to use the preventative factors, the preventative prevention features that we're supposed to be using, like, a face mask and the antibacterial. So that's the labor factor. The finance factor is that a lot of families, there's multi-generational families that they live in the same household. It could be the parents, and then the son and the wife and the children, and then other children of the family, or people that rent rooms from other people. So the finance factor is huge because, especially in a lot of immigrant families, they really tend to help each other. And so they start off in living in multi-generational households. So that does not allow for, if someone's sick, unfortunately what happens is that it doesn't really allow for self-quarantine because they really only have specific spaces. They share the bathrooms, they share the kitchen, they share the living room, the remote controls, things where it's very easy to be able to get sick and transfer the virus. The cultural factor also, and the misinformation is, it's really, a lot has to do with, there's a lot of disconnection. There's a lot of information on a regular basis that's coming out. Not all of it is translated into Spanish, as an example. And a lot of times there's a lot of misinformation out there. So very unfortunately, it doesn't get translated down the line. And so when I said cultural, is that a lot of Latinos are very used to shaking hands, hugs, kisses, and some people feel that it's rude if somebody wants to shake your hand and you say, no, I'm not shaking hands, or they feel culturally, if they are hosting something for an event or some sort, that they really can't say, well, you have to have a mask, or I'm sorry, you can't visit me if somebody shows up at their house. So that's a huge factor that I feel that is really, really problematic.
And you have tried to combat this by creating a website in Spanish. Tell us about that, or a Facebook page.
Exactly. So what I did is I created a Facebook page in Spanish, which I thought was very, very critical and important to be able to provide local information for local resources and local information as to what's happening here. I realized that my parents were looking, when all this started, my parents were looking at the national media, or international media. They were looking at what was happening in Spain and Italy. They were very fearful. And so it was really critical and important that they felt the connection to the local on a local level. So that's the reason why I decided to open that page, to be able to ensure that people realized and learned what was going on a local level.
And just give us a couple examples that you've put into your page to educate the Latino community.
So we're putting a lot of resources on there, and it just depended on what was going on at that point. We put resources for how to talk to children about COVID. We also added resources as far as being able to look up information, local information, as far as numbers, the shelter in place, translated information. One that I'm working on that I feel is very critical and important with the reopening, I feel, and I'm seeing a lot more people getting together for that barbecue or Father's Day coming up. So one of the things that I'm going to do is I'm going to show how to host a barbecue. during COVID. Because guess what, Kurt, it's going to happen. And we need to ensure that as we move forward, that we are able to provide information that's relevant. So how to host it, as far as not sharing utensils, have the antibacterial there, encourage the 6 feet distancing. As far as if you're hosting something, ensure that it's just families at each table. We have to be creative, and we have to ensure that people have the tools necessary to be able to make the right choices. People want to continue to live, but they need to ensure that they are using prevention tactics, because I can tell you that with the increase, just the 56 increase here in Stanislaus County in one day, it's really scary, and it's not even flu season.
Finally, what kind of response have you gotten on your Facebook page?
Oh, you know what? There's a lot of people that follow us on that Facebook page, and they have a lot of questions, and so a lot of the responses towards follow up. Hey, so if this happens, what should I do? I mean, it's just so important for us to be able to ensure that the community feels they're connected and they're part of the overall local community. So a lot of their voices, I go ahead and advocate on their behalf with the county levels, with our state or federal legislators, because the thing is that it's very important that their voices are heard.